Hi, I'm Dr. Tracy Pfeifer, an aesthetic plastic surgeon in New York City. Today I want to talk about a topic that's near and dear to my heart. A lot of you may know that I specialized in breast augmentation revision, and today a lot of patients are concerned about implants and they want to find out their options, specifically with respect to breast implant removal. I actually gave a talk on this a few years ago at the Atlanta Breast Meeting, and I was trying to stress to my fellow plastic surgeons that if a patient wants to have her breast implants removed, it's okay, and she's not going to look deformed, because this is what happens sometimes. A patient has breast implants, she may have a beautiful result, she may have aesthetic concerns that she wants to address and have an exchange, but today I'm specifically talking about people who had breast implants and they just want to take them out without putting an implant back in. A lot of times the patient will come to my office and say that she spoke to her plastic surgeon and they advised her that she's going to look deformed if she removes her implant. And I have to tell you that I have not found this to be true in my experience. There are two types of patients typically who have breast implants. One is a person who always had small breast tissue and she needed an implant for volume. There's another group of patients who either from pregnancy or weight loss had full breasts, but after the weight loss or the pregnancy, they lost volume in their breast, and so they needed an implant to replace the lost volume. Some of these patients may also have been borderline for needing a lift, meaning they had extra skin or the nipple was sitting too low on the breast, and so a little bit of tightening of the breast envelope was necessary, but they didn't have it because when they put the implant in, the implant took up the extra skin and sort of space of the breast. So these are two distinct groups of people. When somebody comes in and I ask them about when they first had their implants, if they tell me that they had small breasts with very tight tissue, even if they had a pregnancy afterwards, I find that when I take out the implant, while initially the breast looks deflated and has a poor shape, it will tighten up over time and the breast tissue kind of fluffs out and it regains a shape and the skin contracts. And it has a pretty shape. A breast lift is not necessary, no additional incision on the breast. The analogy that I use to explain this to my patients is when you're pregnant and you have a baby and you deliver the baby, you're thrilled, of course, and then you go and sit on the toilet and you have all this extra skin sitting there and you're like, oh my gosh, look at all this, what's going to happen? And nobody comes racing into your room and says you have to have a tummy tuck tomorrow to get rid of that skin. They say, just wait. It's stretched and it's going to shrink back. And I find that that is the case in patients who had tight tissues at the time of their breast augmentation. I show patients a picture of somebody who had implants for 17 years, 400 cc's, and you can see how her breast looks deflated, and then in a few months she has regained a shape and she needed no additional surgery. That picture is on my website and we'll link to it below. Now the second group of patients, those who might have needed a lift when they had their augmentation, they may need to have additional surgery. But even in those patients, I tell them, let's take out the breast implant, let your tissues heal as much as possible, and then let's decide together whether or not you want to have a lift with the additional incision on the breast. Occasionally, somebody will have their preoperative pictures with them, and we can look at the pre-existing condition of the breast before the augmentation, and then we can decide together whether or not, based on what you look like then, if we want to do a breast lift at the time of the implant removal. And sometimes that's done, and the patients are also very happy with that. The most important thing is that as the patient, you're fully informed about what your options are and that you really are put in the driver's seat in terms of making the decision. If you don't want to have an implant put back in, you don't need it. You can have a pretty result and you can have a natural looking breast that feels soft, you're happy with the volume, you're happy with the shape, and you feel comfortable with your own body and proportions. So I hope that helps. You can certainly visit my website for additional information, and I look forward to seeing you soon.